Recording will go over learning preferences, reading textbooks, reducing test anxiety, and self-care. So some of these slides I'm going to skip over pretty quickly because you have additional recordings about the information. One of the ones we're going to hit on just briefly is learning preferences. There's 4 different types of learning styles: visual, auditory, reading, writing, and kinesthetic or hands-on. I'm not going to really go into it now because you have a separate video that covers these, but I wanted to leave them in the PowerPoints in case you wanted to take notes or anything like that. There's also a video about active reading as part of this week 3 module. So I'm not going to go too in depth about tips for reading. The one thing I did want to hit on is that a big component is that you're reviewing the information, going back and making sure that you understand what it is that you've read. So you don't want to be a reading zombie where you're reading the same paragraph over and over again and it's not sticking. So you have a different video with tips for active reading, which will help you remember the content. Just wanted to review the study cycle with you. Sometimes there's students who in the past can get away with just coming to class and studying before an exam and getting A's in a course. And likely you're realizing that this isn't going to work in nursing school. So the study cycle that could help you out through nursing school would be to preview readings, notes, summaries, tables, charts, diagrams in the textbook. So review what it is that you're going to be going over in class. Read the assigned readings and write down notes. 2 is attend, go to class, pay attention, ask questions, and take meaningful notes. 3, a big one that gets overlooked a lot, is review. Within 24 hours of the class, you want to review notes, fill in gaps, and develop any last-minute questions you might have. The best time to review material is the same day that you had the lecture. So even though you spent 3 hours in lecture and you feel like you've done your duty for the day, you really want to look at it again that day to really help lock in that new knowledge that you've learned. 4, study regularly. Again, we can't cram the night before. It needs to be on a regular basis. Loosely, they say it's 3 hours outside of class studying for each hour of credit. So your 3 credit hour foundations course would require, or your 3 credit hour LP and RN bridge course would require 9 hours of study outside of the course. So we want to break it up a little bit each day, not just one day a week, to help with retention. And then finally, assess. Do I know the material well enough to teach others? That's a big one. So if you don't know it well enough to teach others, then you don't have a grasp of the concept yet, and you need to keep studying. All right, test anxiety can present different ways in different people. The student may have an inability to concentrate, could feel angry or frustrated, have nausea, vomiting, headaches, fear, feel faint, feel like their heart is skipping beats, or have fast, shallow breathing, or have feelings of impending doom before the test. And so most people are nervous before an exam. That would be considered normal, but the test anxiety that we're talking about is like next level anxiety. So that type of test anxiety, do you feel nervous or freeze up, unable to think before a test? So like the night before the exam, you got all the content down, you know it, and when you sit down, the paper's in front of you, you just go blank. Do you experience nausea, vomiting, or diarrhea? I had a student, I taught a pharmacology course, and she failed the first exam, got like a 50%. And after that, even though she ended up passing the course, before every exam, she'd feel nauseous, she'd throw up. She ended up getting on medication, but not taking the entire medication because she was scared it would make her drowsy. So that's the type of test anxiety that we worry about and we don't want you to be experiencing. And if you do feel that way, you want to reach out to your provider. There are students that have used counseling before to help cope. Provider may prescribe medications. Another option would be testing accommodations. Sometimes students, if they have a longer period to test, they feel more comfortable and have less anxiety. And then last question there, do you feel like you might pass out when testing? So what causes test anxiety is basically that sympathetic nervous system, the fight or flight, gets activated in the body. You may have had a bad experience in the past, like the student who failed that the first pharmacology test. You may not be prepared. If you're not prepared, the likelihood of test anxiety is going to increase. And then finally, you could be a perfectionist. So again, it's hard to get A's in nursing courses, and if you're used to studying very little and acing tests, it's probably not going to work that way in nursing school. So you want to prepare yourself. You're on a journey to learn about nursing and learn clinical judgment, become a safe registered nurse. So focus more on learning new knowledge than getting an A. My biggest advice for preventing test anxiety is to be prepared, whether it's skills check off in the lab or written tests in your class. If you go unprepared, you're going to have less anxiety. If you're unprepared and you know you didn't study enough, your anxiety is going to be increased. Things you can do to help with test anxiety when it's occurring: deep breathing, slow deep breathing can help. You can get little stickers that sort of have a texture to them that you can trace your finger around while you're inhaling and exhaling, count to the count of 4, that type of thing. So deep breathing might be something to help you calm down that sympathetic nervous system and slow down the fight or flight response that you're experiencing during a test. Another thing is positive pampering, so that self-care, making sure that you're having a balanced life and not just totally engulfed in school, but doing things, spending time with family or friends, and making sure that you're incorporating self-care daily or weekly. It's important, it's important the night before the exam that you aren't cramming. So it's not that you can't study the night before exam, but it shouldn't be the only time you're studying. Make sure that you're prepared, practice some relaxation techniques. It's nice to get up earlier than normal, 15 to 30 minutes earlier, just to make sure that you don't have any last minute issues, like a train when you're running late, things that you may forget and have to run back to the house for, and then make you late to the test. So just give yourself a little extra time, and then keep reminding yourself that you are prepared for the exam. Test anxiety before the exam. You want to stay away from nervous Nelly. So even if it's your best nursing school friend, but it's someone who gets really nervous and that rubs off on you before an exam, you want to make sure that you steer clear of that person and let them know you're in the zone and you got to sort of stick to yourself before an exam. Remind yourself that you're prepared, practice the deep breathing, and keep a positive attitude. Things you can do during the exam. Some students will save the hard questions to the end. That's fine if you have a paper pencil test, but some things to consider is that it can lead to errors on the answer sheet or the bubble sheet. So if you're not if you're skipping around, skipping questions, you just want to double check and make sure that your answers are aligned properly with the bubble sheet, because that's what gets graded. Also, that strategy won't work on the NCLEX, because the NCLEX is a computer exam where you answer a question, submit it, and then you move on to the next and you can't go back. Other students do a brain dump at the start of an exam. So with the NCLEX, you'll get a small whiteboard that you'll be able to use and write information on. And sometimes students will do a similar thing with either a scrap piece of paper that their instructor has approved, or on the exam itself. Maybe it's some labs they want to write down, or some notes that they just put down, and they can reference while they're test taking, and they know that they've sort of dumped that information in a place that's easily accessible. Remember your test taking strategies that you'll learn throughout this course. And then remember, the NCLEX is always going to feel difficult because it's an adaptive quiz. So basically, if you're answering questions right, correctly, you'll get harder questions. And if you start getting them wrong, you start getting easier questions. But it's adaptive to your knowledge level, so it's going to feel hard to every student that's taking it, because it's going to be a challenging exam. Just a reminder that your textbook has online resources, most of the textbooks in the nursing program. If the inside cover of your textbook has a code, that code gets you the online resources, which might have additional notes, answers to any practice questions in the textbook, additional practice questions or case studies. And then separate from the online access, some of the books also have Elsevier adaptive quizzing, and that would come like as a cardboard insert with a code. So if you haven't set it up with the teacher yet, that's fine if your instructor hasn't had you set it up, but you do want to know not to throw away any sort of papers or cardboard inserts that come along with your textbooks. Self-care, you'll have a separate recording about self-care, but I want you to think about what self-care activities you're going to make time for either daily or weekly. And a couple of things I want to mention about math. First thing is you have to learn your conversions. They should be in the math book. You should be clear which ones you need to know. But for example, you want to know that 1 gram, is equivalent to 1,000 milligrams. Like which one's bigger? Because you'll need to use those conversions in math problems. And I just have some notes about dimensional analysis. When let's say you have a question that's asking you, like, here's your scenario, how many tablets are you going to give your patient? When you're using dimensional analysis, the first thing you do is write down, like, what is it that you're solving for? Because that helps to ensure that you're labeling the answer correctly and you're solving for the right thing. Whatever that label is will also be the unit for the first fraction of your dimensional analysis problem. So if I'm trying to figure out how many tablets, I start at the front of my problem with tablets. I go to the actual written out problem and see what am I provided with in the problem that are tablets. And let's say the patient's taken Tylenol and 1 tablet's 500 milligrams. So I'd put 1 tablet and it's paired up with or married to 500 milligrams. The next step then, the top of the next fraction would match the bottom of the previous one because that's how they'll cross out. So I don't think you're quite to that step in math yet. But I just wanted to talk about the importance of setting it up or starting it properly, because if you do that, it'll sort of drive itself to give you the right answer. Make sure that you're always double checking the right answer or the answer and making sure that it makes sense. And if you ever want to schedule an appointment for any additional help with math, feel free to do that with me or use Open Labs, Math Labs in order to get the math straight. So here's a simple question. How many milligrams are in 2 grams? So what am I solving for? How many milligrams? I start with milligrams. I know there's 1,000 milligrams in 1 gram. I'm trying to solve it for 2 grams. Put a little placeholder, 2,000 milligrams. And then you go back and make sure it makes sense. Or a little harder, how many tablets would the patient take if the ordered dose is 1 gram and available is 500 milligram per tablets? So the question is how many tablets? I write tablets at the end. I start with a tablet. And then we know we have 1 tablet paired with 500 milligrams. I'm trying to get to grams though. So I put milligrams on the top, grams on the bottom. This is my conversion fraction. Then finally I can bring in this 1 gram from the problem. And I'm solving per dose. So the milligrams would cross out, grams would cross out, and I'm left with tablets per dose. Correct answer is 2 tablets. Go back and make sure it makes sense. Okay, I'm going to give 2 tablets, 500 milligrams each. That's 1,000 milligrams, equivalent to 1 gram. Yeah, that answer is correct.